Welcome. Today, we're diving into a rare and often overlooked heart condition, coronary artery dissection, also known as SCD. This condition can strike unexpectedly, even in seemingly healthy individuals, and understanding it is crucial for early diagnosis and effective management. The exact causes of CD are often unknown, making it a challenging condition to pinpoint. However, several factors have been linked to its occurrence. These include fibromuscular dysplasia, or FMD, a condition affecting artery walls, hormonal changes, particularly during pregnancy or postpartum, extreme emotional stress or intense physical exertion, and underlying connective tissue disorders like Marfan syndrome or Ehlers-Danlos syndrome. In some cases, SCD can also be associated with systemic inflammatory conditions or even occur spontaneously without any identifiable risk factors. Now, let's understand what happens in the body during SCD. The coronary arteries are the vessels that supply blood to the heart muscle. In SCD, a tear develops within the wall of a coronary artery. This tear creates a space, or false lumen, where blood can accumulate. The buildup of blood can then compress the true lumen, the actual channel through which blood should flow, restricting blood flow to the heart muscle. This can lead to chest pain, heart attack, and in severe cases, even sudden cardiac death. SCD is considered a relatively rare condition, but its exact prevalence is difficult to determine because it often goes undiagnosed or misdiagnosed. It's estimated that SCD accounts for a significant percentage of heart attacks, particularly in women under the age of 50. While it can occur in anyone, women are disproportionately affected, representing the majority of SCD cases. The condition is often underrecognized, and research is ongoing to better understand its true prevalence and demographic distribution. The symptoms of SCD can mimic those of a typical heart attack. The most common symptom is chest pain or discomfort, which may feel like pressure, tightness, or squeezing. Other symptoms can include shortness of breath, nauseousness, sweating, and pain in the arm, shoulder, or jaw. It's important to remember that the symptoms can vary in intensity and presentation from person to person. Any sudden or unexplained chest pain should be evaluated by a medical professional immediately. Diagnosing SCD can be challenging, as it requires a high degree of clinical suspicion. The primary diagnostic tool is coronary angiography. A procedure and a dye is injected into the coronary arteries, and X-rays are taken to visualize any abnormalities. Intravascular ultrasound, or IV use, and optical coherence tomography, or OCT, are also used in conjunction with angiograms to see a higher resolution view of the artery wall. Because SCD can have variable appearances on imaging, experienced interventional cardiologists are key for appropriate diagnosis. While SCD is generally classified based on angiographic appearance, the most widely used classification system categorizes CAD into three main types, each characterized by distinct angiographic features. Type 1 shows a dissection with multiple lumens. Type 2 involves a long, diffuse narrowing of the artery, often resembling fibromuscular dysplasia. Type 3 has localized or tubular stenosis. These classifications guide treatment strategies and aid in understanding the underlying mechanisms driving the dissection. The treatment for SCD depends on the severity of the condition, the location of the dissection, and the patient's overall health. In some cases, conservative management with medications like aspirin, beta blockers, and AC inhibitors may be sufficient, allowing the artery to heal on its own. In other cases, particularly when blood flow is severely restricted, interventions such as angioplasty and stenting may be necessary to open up the blocked artery. However, stenting in SCD can be complex due to the fragility of the artery wall, and careful consideration is required to determine the most appropriate treatment strategy. Cardiac rehabilitation programs are also an important component of recovery, helping patients regain strength and reduce their risk of future cardiac events. Because the exact causes of CAD are often unknown, there are no definitive ways to prevent it. However, managing known risk factors, such as controlling high blood pressure, avoiding extreme physical exertion or emotional stress, and being aware of any underlying connective tissue disorders, may help reduce the risk. Women who are pregnant or postpartum should be particularly vigilant about any chest pain or unusual symptoms and seek immediate medical attention. The prognosis for SCD varies depending on the individual case. Many patients recover fully and are able to lead normal lives. However, SCD can recur in some individuals, highlighting the importance of long-term monitoring and follow-up care. Recent research has focused on understanding the genetic and hormonal factors that may contribute to SCD, as well as developing more effective diagnostic and treatment strategies. Advances in imaging techniques and interventional cardiology are improving our ability to diagnose and manage this complex condition, leading to better outcomes for patients affected by SCD.